Imagine stepping back into a life without knee pain. Thanks to Lexington Clinic's ROSA Robotic Knee Replacement Surgery, you can reclaim your life with a shorter recovery period than a traditional knee surgery. ROSA Knee is a robotic surgical assistant that helps joint replacement surgeons provide a personalized total knee replacement. It uses a camera as well as optical trackers that are attached to the patient's leg to know the precise position of the knee during surgery. This helps surgeons not only accurately carry out their surgical plans, but also place knee implants with greater precision.
The great thing about robotic knee replacement, and the ROSA in particular, is that it really allows us to personalize the operation for each patient.
To determine if ROSA Knee robotic-assisted total knee replacement is right for you, your orthopedic surgeon will perform a thorough evaluation, as well as ask you questions about the knee pain you are experiencing and the impact it is having on your life. If you are determined to be a good candidate for robotic-assisted total knee replacement, your joint replacement surgeon will walk you through the procedure, go over the recovery process, and answer any questions you may have. During the preoperative phase, your surgeon may order a series of x-rays of your knee. These x-rays will be used to create a 3D model of your knee, which will allow your surgeon to develop a surgical plan tailored to your unique anatomy. On the day of surgery, you must have a driver who can remain on-site for the duration of your operation. You cannot use a taxi or rideshare service. After you're checked in, you'll be led back to a room to prepare for your operation. The medical staff will give you an anesthetic or spinal anesthetic ahead of the surgery. You may also receive nerve blocks, which will help control the pain in your lower body. With the help of ROSA Knee, your surgeon will remove the damaged bone, place your knee implant, and assess the state of your soft tissues. Once your knee replacement has been completed, your surgeon will finish by closing your incision. The operation typically takes only about 45 minutes. After your surgery and once the anesthetic has worn off, the medical team will have you get up and walking, putting your full weight on your new knee replacement to ensure everything is well.
Typically, we try to have our patients up and walking within 30 to 45 minutes, and our goal is to try to get a patient home within about 2 hours after completion of the procedure.
Following your robotic-assisted total knee replacement procedure, you will start a recovery plan that has been specifically designed for you by your surgeon. You will also be provided with guidelines to follow during your recovery period. You will typically receive physical therapy at home for about 2 weeks post-surgery.
They'll typically see you at home for 2 to 3 days per week, usually for anywhere from 2 to 3 weeks. At that point, you're getting around a little bit better, and we'll get you into outpatient physical therapy. Most patients will need 6 to 8 weeks of physical therapy following a knee replacement.
Your physical therapists will give you further instructions during this period. As everyone is unique, recovery time will vary from patient to patient. However, most patients are able to start driving after 2 weeks, perform light activities such as gardening after 3 to 4 weeks, and return to recreational activities such as golf after 6 to 8 weeks. As your recovery progresses, your doctor will let you know which activities you can start doing again. To learn more or to see if you are a good candidate for total knee replacement with ROSA Knee, please call Lexington Clinic Orthopedics Sports Medicine at 859-258-8575.